Welcome. My name is David Cummings. I'm the Health and Safety Coordinator for the County of Lambton. Today's training presentation is on illicit drugs and drug paraphernalia, including sharps disposal. In this session, we will review how to recognize and assess the hazards posed by illicit drugs, drug paraphernalia, and sharps, and assess them for risk. We'll learn how to address those risks through procedures to be followed when drugs, drug paraphernalia, or sharps are suspected or found, as well as any other measures to help keep us safe. The county endeavors to maintain a healthy and safe work environment. To this end, everyone from frontline staff to management must do their part. Ensuring that incidents are promptly reported and addressed is a shared responsibility. I chose to define the issue as illicit drugs and drug paraphernalia for a couple of reasons. First, it covers the drugs that may be illegal, such as cocaine and cocaine derivatives, but it also includes legal drugs, such as marijuana, that are being misused. Regardless, whenever we encounter an unknown substance, we must treat it with caution as it may be potentially dangerous. Illicit drugs are substances that the government has either made illegal or has regulated as controlled substances. When a controlled drug is used in a way that is counter to the requirements, the use is illicit. Some examples include opioids and their analogs. Analogs are chemicals that are similar in structure to the opioids: codeine, morphine, oxycodone, fentanyl. Amphetamines, crack cocaine, or other prescription and over-the-counter drugs that are being misused. Drug paraphernalia includes any equipment, products, or accessories intended or modified for making, using, or concealing illicit drugs. These can include pipes, tinfoil, spoons, or other containers to use for cooking, liquefying the substance, needles or syringes, straws, rolling paper, and lighters. Sometimes we may encounter illicit drugs in tablet form. Sometimes we encounter them in crystalline or powdered form, sometimes as liquids. Drug paraphernalia used to prepare the drugs for consumption include things like spoons, vials, etc., or as a means of consumption, such as bongs or syringes, must be assumed to be contaminated with residual drug. Bottom line, if you're not sure what a substance is, don't touch it, secure the scene, and contact management. This image from CBC News shows drug paraphernalia in front of a business in downtown London. Some of the items to note: the blue cap, possibly used as a cooker, the barrels from syringes, there's a needle cap, as well as a number of packaging and leftover alcohol swabs, possibly used for injection, as well as a glove. This image, taken from North Bay, shows fentanyl in raw form. There are a variety of illicit drugs. Typically, they are classified by the effects on the body. Depressants, which depress or slow down the central nervous system, include things such as opioids, alcohol, sedatives, and benzodiazepines. Stimulants, which increase the central nervous system activity, including tobacco or nicotine, caffeine, and amphetamines. And hallucinogens, such as ecstasy, cannabis, or magic mushrooms. One of the main drugs of concern are opioids. Opioids are a class of drugs used to control pain and include things like prescription opioids such as oxycodone, hydrocodone, morphine, etc., and illegal opioids such as heroin, illegally produced opioids, and opioid analogs. These come in a variety of forms, including lozenges, tablets, sprays, patches, and injectables, liquid form. And they also come in a variety of colors. It is important to understand how we can be exposed to these drugs and thus be affected. There are a number of routes of exposure. First, through the inhalation of powders or aerosols, we breathe in the drug. Some drugs, like crack cocaine, are vaporized and inhaled. Incidental ingestion, we eat the drug. This often happens when the hands become contaminated with the substance, and then we either touch our mouth or when we're eating something else, contaminate the food that we are consuming. This is not a very common way, but again emphasizes the need to always practice good hand hygiene. Note, with drugs and drug paraphernalia, hand washing is required. The use of hand sanitizer may actually increase the risk of absorption of the chemical into the skin. Third, injection by syringe or needles. This often will happen for us in an accidental form where we come in and encounter with a sharp unintentionally and have a needle stick. Skin, eye, and mucous membrane absorption is the last way. The drug passes through the tissues and enters the body. While this is the least effective way for the drug, typically, if it's in powdered form, to enter the body, and an overdose is not typically expected from such an exposure. However, liquids and gels is another matter and might pass very quickly into the skin. When we consider opioids and opioid analogs, the signs and symptoms of overexposure can include dizziness, confusion, drowsiness, sleepiness, stupor, trouble walking and or talking, constricted pupils. The pupils are like pinpoints. This is a very typical sign of an opioid exposure. Cold, clammy skin, and discoloration of the lips and skin under the fingernails, turning slightly blue. Slow, shallow breathing, and respiration slows to the point where the person loses consciousness and cannot be roused. Depending on the type and dose of the drug and the person's tolerance, life-threatening effects can occur within 2 minutes. Please note that what helps to distinguish an opioid overdose from other medical conditions are the pinpoint pupils and that the individual is unresponsive. Whenever we talk about controls, we need to consider the hierarchy of controls. The best way to control the risk of exposure to illicit drugs and drug paraphernalia is by elimination. This requires that if we suspect someone is using drugs in the branch, we need to take action by enforcing the code of conduct, reporting it to management, or calling police as required. If you witness the use of illicit drugs on library property, you are asked to call police. In either case, complete a violation of rules of conduct report form and submit it to your immediate supervisor or their designate. Currently, management is looking at different design elements to help discourage illicit drug use in our libraries. One example is the use of cameras. We have used cameras to effectively address some patron behaviors. Another way we are working to help keep people safe is by implementing procedures such as the one you're being trained on today. So when you recognize a potential problem, you know how to address it safely, essentially to secure the scene and notify management. The last means is the use of personal protective equipment for those involved, particularly in the physical cleaning of substances. Some things to do. Do secure the scene so nobody else comes into contact with the substance. This keeps them safe. It also helps prevent it from being accidentally spread or becoming airborne. Do report suspected situations to management so that they can be addressed proactively. And if you suspect an overdose or witness drug use in the library, call 911. Some things not to do. Don't disturb the scene. Don't touch, smell, or taste anything that you are not sure what it is. Don't do anything that might cause a powder to become airborne. Keep people away. If you can close a door, avoid increasing air movement through the area. If you think you may have come into contact with an illicit drug, wash your hands right away with soap and water. Don't touch your eyes, nose, or mouth, or eat or drink until you have thoroughly washed your hands. Do not use hand sanitizer or bleach to wash your skin, as this may increase skin absorption of the drug. Please report the contact promptly to your immediate supervisor. If you suspect illicit drug or drug residue, first, don't disturb the scene and avoid any actions that might cause you to come into contact with a suspect illicit drug or cause it to become airborne if in powdered form. Quickly assess the scene by taking note of the quantity and the form of the substance. This helps to determine the risk. If nothing is visible, the situation likely presents minimal risk. If the illicit drug appears to be in pill form, the risk is also likely minimal. Where powder is visible, the risk increases. Secure the scene to prevent others from coming into contact with the suspect illicit drug. In a bathroom, close the bathroom. In other locations, use your best judgment. It may even involve closing the branch. As quickly as possible, notify management. There's always a supervisor on call. If the situation involves someone who appears to have overdosed, we know this from, they would have pinpoint pupils, very shallow breathing, perhaps unconscious, or difficult to rouse, summon a person certified in first aid to provide supportive care. Call 911 and notify the supervisor. If you believe you have been exposed and experiencing symptoms like irritation of the nose and throat, headache, dizziness, nausea and vomiting, confusion, difficulty breathing, immediately report the symptoms to your immediate supervisor. Your supervisor will complete an incident report form and submit it to Occupational Health and Safety Support. Where required, seek appropriate medical attention and advise the medical practitioner that the contact occurred in the workplace. If you are experiencing symptoms, do not operate a motor vehicle. Treat drug paraphernalia with great care. Always assess the scene and treat as per SHARPS, which procedure we'll now be getting into. SHARPS is a medical term for devices with sharp points or edges that can puncture or cut the skin. Part of drug paraphernalia are drugs or syringes used to inject the drug. Sharps increase the risk of exposure by penetrating the defensive barrier of the skin. A needle stick is an inadvertent puncture of the skin with a non-sterile instrument or sharp. Here, the concern is not only with the drug, but also with biological hazards, pathogenic organisms, bloodborne illnesses. Sharps include needles or syringes, blades, lancets, or finger stick devices, and auto-injectors. The primary issue for sharps is exposure to bloodborne illnesses. Biological hazards are difficult to recognize because we cannot readily see them, so we make some assumptions. Routine measures assumes that all blood and bodily fluids are contaminated, so we follow universal or standard precautions. Sharps, such as used syringes, needles, and the like, are also assumed to be contaminated. Be aware that sharps sometimes are hidden and we can't see them. They can be hidden in garbages, in gardens, and so on. So as a general advice, be careful where you place your hands. Try not to put your hands anywhere where you cannot see. If you cannot see, use a tool instead. As I mentioned, needle sticks can result in exposure to bloodborne illnesses. Hepatitis A and B are vaccine-preventable illnesses. You may have heard of the Twinrx vaccine, and that is available from your healthcare provider and is covered under some benefit programs. Typically, 2 doses are given. However, a 3rd dose may be required to achieve immunity. Please consult with your healthcare provider. Hepatitis C can result in liver disease, cirrhosis, and sometimes in cancer. The challenge with hepatitis C is that you do not have to be symptomatic to be infectious. So you're able to transmit the disease yourself without having any signs of ill health. While there is no vaccine for hepatitis C, there are now effective treatments to control the effects of the disease. HIV has obvious health impacts, although treatment options have greatly increased the survivability of the disease. While the risk of contracting hepatitis from a needle stick is very low, less than 1%, it is not zero, and so we still need to be concerned. Some things to do and don't do with sharps. With sharps, do use gloves. We would put on the disposable nitrile glove first and the puncture-resistant glove over top. Carefully place the sharp into a hard puncture-proof container, and do perform hand hygiene when you're done cleaning up the sharp. Do not use your hands to pick up the sharp. Use the tongs or a pair of pliers. Where possible, do not hold the disposable container in your hand. Set it on a flat surface. Don't push down paper towels and waste receptacles or put your hands anywhere you cannot see. If you can, use a tool instead. And never recap a used needle. Procedure for a found sharp. First, secure the affected area. Then, retrieve the required equipment: hard container, tongs, disposable nitrile gloves, reusable puncture-resistant gloves, or send someone to retrieve it. Put on the nitrile gloves, followed by the puncture-resistant gloves. Place the container on a firm, level surface near the syringe. Do not, if possible, hold the container while placing the syringe in. Using the tongs, pick up the sharp, keeping the needle point away from you, and place it in the container. Close the container. Be sure to disinfect the tongs using the approved disinfectant wipes. Return the equipment to the storage location. Remove and disinfect the puncture-resistant gloves. Remove and dispose of the nitrile gloves. And wash your hands thoroughly. And contact a supervisor or their designate. Always report found sharps to your immediate supervisor. Never overfill a sharps container. Only fill to the line. If you notice that the sharps container at your facility is becoming full, advise your immediate supervisor. Management will make arrangements for appropriate disposal. In case of needle stick injury, let the wound bleed freely. Wash thoroughly with soap and water. Report the injury to supervisor and seek immediate medical attention at Blue Water Health, Sarnia campus. Unless you've been trained in how to properly dispose of sharps, do not touch them. Notify your supervisor. Lambton Public Health has prepared a video for the general public on sharps encountered in public spaces. We're now going to watch that video.
If you find a needle, dispose of it safely. Lambton Public Health is working with community partners to support a harm reduction program that involves community safe disposal bins in Lambton County communities. Public safety is a priority, and your help makes our community a safe place to live, work, and play. Learn more about steps for safe disposal. Call for help options if you can't dispose of a needle safely. Steps for safe disposal. Treat all needles and drug equipment as contaminated. Step 1. Wear gloves to protect yourself. If you don't have gloves, proceed cautiously and remember to wash your hands thoroughly after. Step 2. Pick up the needle in the middle of the barrel using tweezers, tongs, pliers, or anything that limits contact with your hands. If you have to use your hands, consider limiting contact by using a paper cup or napkin. Step 3. Carefully place the needle in a puncture-proof, sealable container with the sharp end first. Close tightly. The container could be a plastic or glass drink bottle or a lunch container. Step 4. Place the container in one of the bright yellow community safe disposal bins. The garbage or toilet is not a safe disposal option. It puts others at risk. Your safety is important. If at any time you feel disposal of a needle can't be done safely, please call Lambton Public Health. at 519-383-8331. Thank you for your support to help keep our community a safe place to live,